Greetings everyone, Dr. Garret here. So I want to speak to you a little bit further on, a little bit deeper on the concept I introduced a week or so ago in my last video about the model that I've taken in my own life and I'm helping people, navigate and utilize in their own lives to help transform their health and their life. And this is that system that works in conjunction with what you're getting at performance. It doesn't replace it, it works in conjunction. It's like an extension of it. And so I want to go a little further into that, give you a little bit of a visual on what that looks like and possibly what the experience could be like for you. So let me just click on opening my iPad and I'll show you what I'm talking about. So for those of you that know this, I'm going to probably show you my age a bit. At the malls, there's that "you are here" dot. So when you come into performance, when you meet me, you're in a place in time. You're at a place in time with a certain state of being, a certain state of health. And let's say that's here, and it could be an injury. Let's say it's showing up with a symptom, a condition, or an injury that you're experiencing. It could be pain, could be stiffness, it could be a condition like a low back issue or a low back flare-up. But you show up with this. Now, there is a certain amount of normal. So this is your normal. So before you were injured, before you had this condition or this symptom, there was a level of health that you had based off the habits, based off your lifestyle up to that point. And so the goal of performance, the goal of those therapists and docs that are there is to get you back to that place. And so this is really, and in some cases to an even higher level of your normal. So even better than when you came in. Now, this model is what you see in most clinics, for most doctors, most therapists. And so this is what that looks like. This is a doctor-dependent or therapist-dependent type of model. In other words, you rely on that care, on that service, on that application of that treatment in order to experience a change or an improvement in your condition or symptom. So this is fundamentally a treatment type model. So you're receiving a treatment. That is transactional, which means that when you come in and you get care by the chiropractor or by physio or by the massage, naturopath, acupuncture, any discipline, you receive something, you receive an outcome from a service that's applied to you. And that's that transactional treatment model. And it is doctor or therapist dependent. It's very much the conventional model of care. So this is conventionally how healthcare is working right now. This is the model of care, and it will get you to pre-injury status or bring you above where you would normally function. And for many of us, that is a perfectly acceptable and actually the goal that we're looking to achieve. That's what we truly want. Now, for some of us, it goes beyond that. In other words, we don't want to experience the symptom, the condition any further. We don't want it to come back. For some of us, it's been on repeat. This is what I experienced with my own back pain. I saw chiropractors, I saw physios, massage, acupuncture, naturopath, and man, they were incredible. Being a national team player and a pro athlete, we get the best of the best. And they were keeping me functioning and being able to play at the highest level. When I retired and I started as a chiropractor, I continued to have these aches and pains. I continued to have the stiffness and the back pain, despite getting the care. But I had a goal, an outcome that I wanted, which was I didn't want this anymore. I didn't want the stiffness, didn't want the achiness. I didn't want the flare-ups anymore. And that's what started down this journey of me finding out what was leading to my back pain and making that change in my lifestyle and I got the effect of not having back pain anymore. So there is this place where you can move from your normal to let's call it true normal, which is where our natural state is. We're naturally designed to be healthy. We're naturally designed to thrive in life, to expand, evolve, and grow. But it's a different model to do that. So this model, taking you from where those docs and therapists at Performance just took such good care of you and allowed you to go on this part of the journey to start this new phase of your health, is a different model. Now this model is, we'll call it patient empowered. So this model empowers you to make change so that you get the transformation you're looking for. So this is not the treatment model, this is lifestyle or coaching or learning model. We'll call it coaching. So this requires some study, some learning of new information, but not just learning and accumulation of information, but application, embodiment of that information so that you take action on it instantly, which then that's what leads to the transformation. Because we're changing our lifestyle, our habits, our way of being, our state of being. And that leads to that transformation that happens in our entire life and our body and our health. And this really is the innovative model. The innovative coaching and learning and application of information. And it really has everything to do with your lifestyle habits. So this model up here is really about you making fundamental changes in the habits of how you function in life. This is about treating you so that your body can get back to where it has the ability then to get to this other model of care, to this adjunctive model of care. Now, there is even a higher place from this true normal that I think becomes elite. And this is where it again is not treatment, but it's adjunctive type of applications and habits and actions that you can take that can take your health to an elite level. And it might include things like supplements that are built on top of diet and nutrition, because just going back to this true normal, if it's lifestyle, this is the diet and nutrition. This is the posture and movement mechanics. And it's about your thoughts and emotions. So this model is about addressing how you eat, move, and think. So that's what we're primarily and fundamentally augmenting and changing, is how you eat, move, and think. And that brings balance back to your body. It sets the foundation that allows you to come to this true normal. So to get to the elite, we can start to add supplements to the diet and nutrition that you're having. We can add exercise so that you physically develop in a way that gives you more, like endurance, more strength, more ability to function and work stronger and harder. And then we can add meditation, which is a tool to allow you to get even more clarity and stillness in your mind, to be able to take your thoughts and your emotions to a different level. This is fundamentally the model that would allow you to go from fundamentally where you're injured, hurt, dealing with a symptom and condition, to getting to a state of normal, a foundational model that you can start implementing these foundational concepts to get you to your true normal. And then should you desire to evolve or expand even further, thinking about things like supplements, exercises, meditations to take you to an elite level of health. And that is a really exciting journey that you can take here at Performance, because we've decided to bring this into this model. So it is not for everybody. It's for those of you that, want to take your power back, your responsibility, and become accountable for what you're doing in your life. For the care that you're receiving, to take fundamental responsibility for your health, and so that you can then experience what you're meant to experience. So it may not be for all of you, but for those of you that this resonates with, I invite you to again connect, talk to the team up front, and they'll be able to point you in the right direction. So my name's Dr. Garret. Thanks for joining me, and I hope it gives you a little more clarity on what's possible for your health.